In the beginning, there was the dream of our founders, Dr. John Nersessian, Dr. Nabet Kasabian, and may he rest in peace, our friend, our pharmacist, Koren Nalbandian. And that dream became a reality, an organization now known as the Armenian American Health Professionals Organization. Today, guided by a 32-word mission statement that the original board developed, we now have over 500 healthcare providers working together using AAHPO's platform, which unleashes their collective passion and commitment to helping others. What is AAHPO? AAHPO is a all-volunteer 501c3 medical philanthropy, multifaceted in our mission. Our mission is to improve healthcare awareness, increase disease prevention and early detection, foster fellowship and career development of Armenian healthcare professionals, and provide medical support and education both to our local communities and in Armenia. Armenian healthcare providers in its network. Our strength is in our diversity. It's really magical, over 25 years, how this organization has come together. It is really because AAHPO has the secret sauce. It has a social ingredient as well as a professional ingredient. When you mix the professional and social elements together, it's a combustible combination. It's really infectious. Today, our programming and joy in helping people and passion comes through its attracting a growing, younger crew of medical students, residency students, transfer students from abroad who are seeking to advance their medical careers. And what we see through our professional development efforts is a young, growing, intelligent, inspiring group of youth who will be AAHPO's future in years to come. Medical outreach is critical to improve the lives and health of our community. We do this through a range of programs. It all starts on a grassroots level, where we can help an individual in a time of need who contacts us through the AAHPO hotline. We then go to the churches, where we conduct medical workshops. We typically have 5 healthcare providers go into a church and talk in a very conversational way with parishioners. And we answer all of their questions. And in doing so, they come to know us as people, and barriers between doctors and patients break down. The idea behind this, and many of our programs, is to share our knowledge and expertise. This program has been proven to be very successful and very well attended.
I'm so happy that I was able to come and listen to the doctors speaking. They were absolutely wonderful, and we got lots of new information. Another
program which has proven to be successful has been to have healthcare programs in our Armenian schools and to share with the parents and teachers and administrators the latest information from our experts in psychology, psychiatry, pediatrics, infectious disease, on the impact of technology, vaping, vaccinations, and other critical issues to our youth. AAHPO also realizes that being Armenian means that we have very special and specific medical needs. If we need a bone marrow transplant, it is not easy to come by a match. So AAHPO has sponsored many bone marrow screenings to help those in our community who are in desperate need for a match. AAHPO's TV programs, hosted by Dr. Ohan Karataprak, is an example of a terrific collaboration with Voice of Armenians TV, New York. This show features Armenian healthcare providers who educate our community about important health topics. The reach of this show cannot be underestimated. One of the hallmarks of AAHPO is that we're able to extend our influence and reach through collaboration and strategic partnerships. These partnerships allow us to develop multi-layered, self-sustaining healthcare programs. Our medical missions, telehealth, and continuing medical education programs are examples of this integrated approach, where these independent programs work synergistically.
I'm very passionate about the AAHPO medical mission, which goes to Armenia on a yearly basis. It's an incredible experience. You go and you meet the people in Armenia, especially in the rural villages. We create friendships. Every year I go back because I meet amazing people and we learn how they live and how they're happy. It's an amazing experience. That's why there's several of us who really return every year. It helps them, but it helps us too.
AAHPO's continuing medical education program started in 2011 and recognizes the fact that doctors in Artsakh, as well as in Armenia, did not have access to continuing medical education since they graduated from medical school years before.
I think we have to look carefully at the medical education and hopefully move it to a point where training is adequate. If we can get young doctors to graduate from school and have really good fundamental training in medicine, then I would be extremely optimistic.
What AAHPO has been able to do with our partner, Fund for Armenian Relief, is to provide training to over 270 healthcare providers with critically needed medical skills that benefit the rural populations of their hometown villages. This number represents over 70% of the doctors in Artsakh. In addition, we regularly communicate with them using the HighBridge telehealth program, where we use electronic technologies to transfer medical knowledges.
We can continue our project in Artsakh for the re-education of the physicians that have not had the pleasure and the possibility of re-education for almost 10 years. This possibility of the CME, which we work through the Fund for Armenia Relief, is a blessing to all the physicians. We've already had the pleasure of educating over 70% of the physicians who are practicing in Artsakh. But our main purpose is so that we can continue the education so that every 3 to 5 years the physicians can come back and continue this.
But more than that, AAHPO's medical mission program interacts with both of these. What we do is we actually go and visit with these doctors that receive training. We work with them side by side. We develop friendships. We develop a rapport. And with that rapport, we're able to increase the level of education and sharing of medical information on complicated cases that benefits all of us.
We all believe in AAHPO's mission in Armenia. We hope that we can train more doctors in Armenia, and we are really grateful to our donors and people that believe in this mission.
We would like to continue training the physicians in Karabakh.
We would like to bring awareness to get more support, because this is a wonderful cause.
We are so thankful for the dream of our founders, and we are so thankful for the participation of so many healthcare providers over the last 25 years who have helped advance AAHPO's mission. Our donors are the essential link between the pillars of our strategic plan and the strength of our future. For the last 25 years, AAHPO has been relentless in fulfilling the dreams of our founders. It is our dream for the next generation to be ceaseless in their efforts to continue AAHPO's legacy of helping save lives.